Hi, this is John Beener again with Wise Counsel, and I'm with Dr. Gill Weise again. We're interviewing him, and we're talking about his experience as a pharmacist and as a natural food expert here at his Weise Natural Food Shop and again pharmacy that he founded many years ago. Been in it 50 years, 85 years old. Hey, tell us, Gill, about your background experience. How did you come to the conclusions you do that really natural good health is better when you take natural good things? Tell us about that. What does that mean? When did you decide that the pharmaceutical remedies or drugs are not the best route as a patient?
Well, it didn't take me long to figure that one out, because when I went to pharmacy school, I had something in my body saying this is not the program that you need to be on.
Okay.
But when I looked at my options, I wasn't a good student, and so I couldn't go to medical school like my two brothers who are doctors.
Okay.
And I'm otherwise. So since I'm otherwise, I went to pharmacy school.
Okay.
And so I got a good shot of in those days, pharmacy was pretty good. You got a good dose of pharmacognosy. You got a good dose of plant variations and things like that. That's not taught anymore. That's gone. That's way long gone. Okay. And the pharmacy industry now owns the universities more or less, and they tell them what the curriculum is and so forth. Mm-hmm. But one day when I was in my pharmacy here in Jacksonville, I kept looking at the same person coming in. They were probably 35, and they were on several drugs, and I thought to myself, well, what is going to happen to this poor man? And I'm giving him the same thing. Week after week after week after week. He never got any better. I decided to have a little talk with him in my office, and he said, I just can't shake it. And so he was addicted to the drug, and he was not going to do anything about it. So I said, well, then where are you going to land? What's going to happen to you? He had no answer. So I gave him the plan of salvation, but I also gave him a plan for eating habits and doing the right thing for his body. Well, he did that for a while. After 2 years, he came back. He said, when I was on your plan, I did real good, but now I'm not on it anymore. Okay. So it was doing real bad. So I said, well, I don't want to do this the rest of my life. Okay. So my dad and my mother had already built the health food shop, so I kind of started venturing away from the pharmacy and landed into the health food shop and started picking up more degrees in there. Well, not degrees exactly, but
education knowledge.
Education knowledge, certificates, and those sorts of things. So I have a varied degree of pieces of paper hanging on my wall that gives me a little bit of credibility. But the Lord has blessed me in giving me enough information to help most anybody through a crisis in their life. I don't care what it is. You got lupus, you got irritable bowel syndrome or whatever. There's always some underlying cause that there is. You could go to the drug always. My war is not against the doctor, the pharmaceutical industry, but my war is between the good and the evil. That's where the war is. And the evil people want to get your attention. And they want to get your money, and they want to get your dollar, and they want to get your drug. They put you on the drug, so you're stuck forever. You don't have to do that, guys. There's other better ways, and we can wean you off of these things and put you on some very powerful, good nutrients and get you the proper point. I've had wonderful success. I've had miracles happen in this office week after week. And so it's been a lot of fun just helping people realize that there is some options. We don't even realize half of what's going on in the United States, around the world. But I have a sheet of paper that I pass out to my patients on how many various things there are for pain. I have over 20 different things that I use for pain. None of them are Tylenol. None of them are Motrin. None of them touch any of those things. I'm pain-free.
Not even aspirin?
Not even aspirin.
How about that?
See, in our program...
So they're nutrients then?
They're nutrients. And you look at a thing called white willow. White willow is on the shelf. That is aspirin. And aspirin...
That's great for headaches, right?
Aspirin becomes... white willow becomes aspirin. So then you have many other things that become drugs in the world and are really in nature, they are something else. For instance, the pineapple core, that core in there, the bromelain in there becomes, for us, a painkiller. Mm-hmm. The boswellia, which is a Ayurvedic herbal medication, is my painkiller. The turmeric is my painkiller. Mm-hmm. The glucosamine is my painkiller. Well, not painkillers, but inflammation reducers. Let's call it that.
That's good.
And then eating correctly.
Right.
Eating correctly.
Yeah.
And you can't tell me that just taking one white willow will do it. It won't be one. It might be 10 per day. Well, it blows your mind that we're going to take 10 white willow pills to get rid of the pain. But you got to put this substance in your body to combat the system that you have full of Tylenol. That's the number one drug that causes you to go to the emergency room in the United States.
Wow.
It isn't anything else. It's Tylenol.
Wow.
So please be careful as you wander down the pain threshold. There's probably in our store we have over probably 10 different kinds of pain creams for your arms, your legs, your back, and everything. Yes, they're expensive, and people don't want to do it because they can't afford it. Well, if you can't afford it and you love the pain, it doesn't make sense to me.
Right, okay.
Just try a little bit, and we'll get you there.
Right.
My first goal was when I was a runner, well, I still am a runner, that if we put ice on the knees or ice on the joint, then that would take care of at least 50% of the pain. Doing that daily, not just once a day or once a year, because we're those kind of people. We don't want to do these habitual types of things because it takes time away from something else that I'd rather do.
Right. So two things we're going to wrap up here with the last commentary, and that is around, you've been doing marathons for 40 years, right? Okay.
No, I've been doing 15K.
Oh, 15K, okay.
United States
That's a marathon
Championship.
to me, since I don't even run a mile. So
Marathon is 26.2.
Okay. All right, so...
And there's a little story there, John.
15K, is that what you said?
15Ks. I've run the Gate River Run for 42 years in a row.
Wow.
And this year I said, Lord, I'm going to give it up. I've had 42 years of it. I've proved myself, and I don't have to do it anymore. Now I can do some other things. And I'll go back and maybe pick up some shorter races or do some other things that'll be more interesting to me.
Okay.
I've done 13 marathons, including London and Chicago and San Francisco and Bermuda and all over the place.
No kidding. Amazing.
One thing I learned in marathon running is that usually at the beginning of the marathon run, there is a coffee truck.
Oh, yeah.
A gasoline truck filled with coffee. Well, the first time I saw that in 1987 or something like that, when I ran my first New York Marathon, I said, what's he doing here? Doesn't that make you shaky and give you diarrhea and all that sorts of stuff? Finally, I researched coffee and found there was no truth in any of that.
Really?
You listen to Dr. Oz and some of these other really flashy doctors, Dr. Phil, they'll tell you coffee is okay. You can't even define what coffee is. Is it a teaspoonful? Is it espresso? Is it 4 teaspoons full? What is it? Is it 1 bean or 25 beans?
Yeah, right.
So get a definition of your coffee. Mine is very mild, and I can have 5 or 6 if I want to any day of my life. Remember, coffee is alkaline. When you add the creamer and the sugar, you're adding the poisons to make it acidic.
Okay.
End of story.
You need alkaline, so.
Yes.
All right, so last subject question is that you have a booklet that you wrote called Possibilities.
I did.
And how can people get a copy of that? That's a very good booklet. I've read it through, and I think it's outstanding.
This little booklet, John, came from a customer of mine. This man was Phil May. He's very well known.
Okay.
In Jacksonville, Florida, philanthropist and a very wonderful, wonderful man, and said, Gill, why don't we write a book about cancer? I said, Phil, if we do that, we're probably going to get arrested for saying we can cure it, and we can't. Now, there might be a way of, as I put on the front, prevent, arrest, corral, or control. We could probably do that. We can prevent forest fires. We can prevent cancer. We can do a lot of preventative things. But a 1% change in your diet may do this. So the book is chock full of some of the things we talked here today. And I wrote a little dedication to Phil May on the first page. And that starts with some vegetables and some possibilities for you to learn. And there's some very dark, hidden secrets in here. These are the things that we say no to. Sugar items, no candy, cake, pie, cookies, no hydrogenated products, and on goes the list. And then read your labels, how to do certain things. And then in the back, some of the foods, not all of them, but some of the foods, and what it provides for your body. So if you pick off of this list and get some things that are providing for your body the nutrition that your body needs, instead of just getting Twinkies and various things that aren't really good for you. So then in the back is a little couple of formulas for you. I think I have the lentil soup formula for you that we put in there because of my mother, who made lentil soup for my father every day in big, enormous amounts to fight cancer. And so we put them in mason jars. And
how can people get a copy of that booklet?
Come to this store. We'll give you a copy.
All right, well, great.
Just ask for it.
All right. Well, thank you so much. This has been outstanding time together. And please stop and see Dr. Gill Weise and his team here at the Weise Natural Food Shop off of Colonial Avenue here in Jacksonville. Otherwise, contact us by email. Thank you so much. Appreciate it. Outstanding.
You're very welcome.
Yeah.
I wish you good health.
Thank you. Appreciate it.